Brain tumors can be very dangerous even in non-cancerous cases. When a benign brain tumor grows and enlarges within the solid structure of the skull, it may damage and compress the cerebral cortex. Seizures, psychosis, behavioral, personality and emotional changes are some of the serious effects of tumors on the brain. Such effects can confuse both the patient and those around him. What are the signs and symptoms of brain tumor? Signs and symptoms of a brain tumor vary dramatically and depend on factors such as the size, location, and growth rate of the tumor. Some of the common signs and symptoms of brain tumors are as follows. Onset and change in the pattern of headaches. Headaches gradually become severe and continuous. Unexplained nausea or vomiting. Vision problems such as blurred vision, diplopia or loss of peripheral vision. Numbness and gradual numbness of hands and feet. Difficulty maintaining balance. Confusion in dealing with everyday issues. Speech disorders. Behavioral or personality changes. Seizures and fainting, especially among people who have never had a history of seizures. Hearing problems. What is the difference between benign and malignant brain tumors? Benign brain tumors are not cancerous. Primary and malignant brain tumors are cancerous and originate from brain disorders and usually grow faster than benign tumors and severely attack the tissue around the brain. Although brain cancer rarely spreads to other organs of the body, it can affect other parts of the brain and central nervous system. Benign brain tumors usually have well-defined boundaries and rarely spread deep into the brain tissue. This feature makes them easier to remove surgically, assuming the location of the tumor is where it can be operated on without minimal risk. But even after tumor surgery, there is a possibility of its regrowth. However, the probability of regrowth of benign tumors is lower than malignant tumors. Despite the fact that benign tumors in other parts of the body can cause problems, they are generally not considered a serious health problem and are less life-threatening. But even a benign brain tumor can cause serious problems for the patient's health. Brain tumors can cause inflammation to damage the cells around the brain and put pressure on the underlying and surrounding brain tissue as well as the inner part of the skull. What causes a brain tumor? Primary brain tumors grow either alone or attached to adjacent brain tissues, such as the covering membranes of the brain, meninges, cranial or cranial nerves, the pituitary gland, or the pineal gland. When normal brain cells develop mutations in their DNA, primary brain tumors begin to grow. These mutations allow cells to grow and multiply rapidly and continue to grow until the body's healthy cells are destroyed. Finally, a mass of abnormal cells will lead to the formation of a brain tumor. Primary brain tumors are much less common than secondary brain tumors, where the cancer has grown elsewhere and spread to the brain. Brain tumors that grow in the brain. There are different types of primary brain tumors. Each is named after the type of cells active in the tumor. Some of these tumors include glioma. Gliomas begin to grow in the brain or spinal cord and include astrocytic tumor, ependymal tumor, glioblastoma, oligostroma, oligodendroglioma. Meningium. Meningium is a tumor that originates in the membranes around the brain and spinal cord. Most meningeal tumors are non-cancerous. Acoustic neuroma, schwannoma. Schwannoma are benign tumors that grow and expand on the nerves inside the ear to the patient's brain, which are responsible for maintaining balance and hearing function. Pituitary adenoma. Pituitary adenomas are basically benign tumors that grow in the pituitary gland and the base of the brain. These tumors are able to affect the hormones of the pituitary gland and have effects on the whole body. Medulloblastoma. These are considered among the most common cancerous brain tumors in children. Medulloblastoma starts growing in the lower part of the brain and spreads throughout the body through the spinal fluid. These tumors are less common in adults, but they can still occur. Primary neuroectodermal tumors are rare and cancerous tumors and occur in fetal brain cells. These tumors may grow anywhere in the brain. Germ tuberculosis. Germ tuberculosis tumors may develop in childhood at the site of formation of the testes or ovaries. But germ cell tumors sometimes spread to other parts of the body, including the brain. Craniopharyngioma. Craniopharyngioma is considered a rare and cancerous tumor and starts growing near the pituitary gland of the brain, which is responsible for releasing some hormones to control many body functions. As this tumor gradually grows, it can affect the pituitary gland and other structures in the vicinity of the brain. A cancer that grows anywhere in the body and spreads to the brain. Secondary brain tumor, metastasis, includes tumors that form as a result of cancer and begin to grow anywhere in the body and spread to the brain. Secondary brain tumors often occur in patients with a history of cancer. But in rare cases, a metastatic brain tumor may be the first symptom of cancer anywhere in the body. Secondary brain tumors are much more common than primary brain tumors. Any type of cancer can spread to the brain, but the most common types of cancer are breast cancer metastasis to the brain, colon cancer metastases to the brain, metastasis of kidney cancer to the brain, lung cancer metastasis to the brain, melanoma tumor. What are the causes of brain tumor? In most patients with primary brain tumors, the cause of the brain tumor is unknown. However, doctors have identified some factors that may increase the risk of brain tumor. The risk factors are the age of the patient. The risk of brain tumor is related to increasing age. Brain tumors are more common in the elderly. However, brain tumor may occur at any age. Certain types of brain tumors are especially common among children. Exposure to radiation. People who have been exposed to a type of radiation known as ionizing radiation, have a high risk of brain tumor. For example, we can refer to radiation therapy for cancer treatment and exposure to radiation due to the explosion of atomic bombs. A link between brain tumors and some common forms of radiation, such as electromagnetic fields from power lines and radio frequency radiation from cell phones and microwaves, has not yet been confirmed. Family history of brain tumors. A small number of brain tumors are common among patients who have a family history of brain tumors or genetic disorders. What are the complications of brain tumor? A brain tumor may cause temporary or permanent brain damage depending on its size and location. The human brain is divided into different parts and each part is responsible for some functions of the body. For example, the anterior part of the brain is responsible for thinking and controlling human motor skills. Occurrence of a brain tumor in the anterior lip can put pressure and invasion on the brain tissue in this area and lead to learning or memory disorders. In addition, this tumor may cause speech or walking problems. Occurrence of a brain tumor in a part of the brain called the occipital lobe, located at the back of the head, can cause vision problems, because this area of the brain is responsible for controlling human visual and perceptual capabilities. It is possible that brain tumors cause a type of emergency disease called hydrocephalus, accumulation of fluid in and around the brain. Hydrocephalus occurs when the tumor blocks the flow of cerebrospinal fluid in and around the brain and causes this fluid to collect in the enclosed spaces of the patient's skull. The accumulation of this fluid may put pressure on the sensitive structures of the brain. It is necessary to remove this fluid from the brain through surgery to reduce the pressure on the brain and eliminate the risk of concussion. Cerebral hemorrhage is another type of emergency disease and brain tumors are known as their cause. This condition requires emergency medical treatment. Also, brain tumor patients may lose their ability to speak or move temporarily after surgery and need rehabilitation services such as physiotherapy, occupational therapy and speech therapy.